free birth control. It's a right!
Women's reproductive rights have been a long and contentious battle for decades, and they continue to be even today. Pioneers like Margaret Sanger, a nurse and radical of her time, fought for contraceptives that women could control. The birth control pill was introduced to the market in 1960, and for the first time in America, could deter pregnancy by their own choice. Even after the pill was made available, the influence of organized religion was strong, like the Catholic Church, which said artificial contraceptives were sinful, and many states prohibited their sales. In 1965, Griswold v. Connecticut was a landmark Supreme Court case which ruled that such laws were unconstitutional by determining that a fundamental right to privacy exists between the lines of the Constitution, and laws prohibiting contraceptive choice violated this right. In 1974, a federal judge also made the right to purchase contraceptives available to unmarried minors. Inevitably, abortion became the next battle in the reproductive rights struggle. Throughout the 1960s, there was no national standard on abortion regulations, and many states outlawed the practice, so women were seeking abortions illegally or brutally performed coat hanger abortions on themselves. In 1973, another landmark case reached the Supreme Court, Roe v. Wade, which claimed the constitutional rights were violated by banning abortions, and the court agreed. One of the big things Obamacare did was give people with health insurance free access to all contraceptive methods approved for women by the FDA. That's all 18 types except for male condoms and vasectomies, as a preventative service. In insurance speak, this access is called coverage without cost sharing, and it means that you don't have to pay copays or deductibles. These Obamacare provisions reduce the barriers separating women from the most effective methods of birth control, and the fewer barriers there are, the better off we are. Studies suggest that once cost sharing was eliminated, women were more likely to use the pill consistently and more likely to use a prescription birth control method, especially long-acting ones, which are the most effective and the most expensive. Complete coverage saves women $1.4 billion per year on out-of-pocket expenses. That's not accounting for additional costs you could face from getting pregnant when you don't want to be. As a country, unintended pregnancies cost $24 billion a year in public health spending.
On October 6, 2017, the Trump administration changed the free birth control mandate, which significantly widened the range of employers that can opt out of offering free birth control for religious or moral beliefs. Prior to the official change, Trump stated, "I will make absolutely certain religious orders like the Little Sisters of the Poor are not bullied by the federal government because of their religious beliefs." This new change by the Trump administration not only allows religious groups to opt out of offering birth control, but it also allows non-for-profit, for-profit, and institutions of higher learning to opt out of offering birth control. However, under the Affordable Care Act in the Obama administration, religious groups were allowed to opt out of covering birth control, but a third party, often the insurance company, was required to offer birth control, meaning it was a woman's private choice to make for herself if they wanted birth control or not, despite their employer's or their school's religious affiliation. Under the Affordable Care Act, both women and religious groups could make their own decision about birth control. The Trump administration admits they have no true way of predicting how many women will be without birth control. One analysis done by the Trump administration predicts that only 120,000 women would lose coverage for birth control. One could even say the lack of access to free birth control actually leaves the woman bullied and out of control of their own reproductive health. Not only did the new mandate leave women without means of birth control, it also increased cost burden on state-driven programs that provide free access to birth control for those who would not have it otherwise. In 2017, Trump signed legislation to decrease funding for Planned Parenthood. The reduction of funding is based on the fact that abortion services are offered at Planned Parenthood. when in reality, Planned Parenthood offers comprehensive women's health services such as family planning, contraception, STD testing, fertility, pregnancy care, and breast and cervical cancer screening. And in states where more Planned Parenthood clinics are, the teen births and STDs rates are lower. Despite this, funding has been cut. Trump's initial attempt was to stop all funding to the organization. With the change in legislation allowing employers to opt out of offering birth control, more women will be seeking services at places much like Planned Parenthood, in which funding has been cut, ultimately further decreasing access to free birth control. An experimental plan offered free IUDs and implanted birth control to teens and women living at poverty level in Colorado. During the experiment from 2009 to 2013, teen birth rates decreased by 40%, and teen abortions fell by 42%. In 2009, half the women in the poorest areas of the state were having their first child by the age of 21. In 2013, the age of women in the same areas had increased to 24 years old. This allowed women the time to complete their education and become employed.
Of 2017, Oregon Governor Kate Brown signed the state's Reproductive Health Equity Act, one of the most progressive reproductive health care laws in the country. The new law makes Oregon the first state to establish comprehensive, state-funded reproductive health coverage for women and the first to stand up to the Trump administration and congressional Republicans by putting the entire list of women's health services covered without cost sharing under the Affordable Care Act into state statute. The legislation also bans discrimination against those who identify as transgender or gender nonconforming, so that all people who can become pregnant have access to reproductive health care. We think that every woman should be in charge of her own reproductive health, and this includes the access to free birth control so that she may make her own decisions regarding her future. Free birth control saves taxpayer money, improves the lives of children and families, and reduces the incidence of abortion. It's clear to see birth control should be free.